thinking more and more about what is human knowledge as artificial intelligence tools are seeping in from all sides. You may have heard the term deskilling. So the idea is that as we as human beings depend more and more on artificial intelligence tools in every sphere of our life, we become deskilled. It's just a polite word for us getting dumber because we're offloading some of our thinking capabilities to the software. What happens in medicine? Are we going to get a generation of dumb doctors in the future? Let's look at how Dr. Robert Wachter uses AI today. Robert Wachter is, of course, a very well-known physician and author. He's the chair of the Department of Medicine at UCSF.
When I'm on the wards in the hospital, in many days I've got I'm a generalist, I'm a hospitalist, and many days I've got questions that I sort of could use a subspecialist to help me with. And so what I hope for is what's called a curbside consult, which means I happen to run into my favorite infectious disease doctor in the cafeteria, can I run a case by you? And now I get 10 to 15 curbside consults in the morning, but I do it using AI rather than being dependent on the serendipity of running into my favorite colleague. So we're all using AI, whether it's using Gemini or GPT or Open Evidence or other tools like that. We're all using those tools to get better information, essentially subspecialty level information for generalists like me. Most of us are using an AI scribe. Most of us are using AI to summarize patient's chart. The AI is drafting discharge summaries. To me, this is all really important, but it's training wheels. It's getting us familiar with and comfortable with using AI in a clinical setting. But those are singles. The real home run here is all decision support. Whether it's decision support for a doctor or a nurse or a patient or a family member.
Now you saw here that Dr. Wachter talks about this virtual, specialist consult that he can do 10 to 15 times a day. Now, Dr. Wachter has decades of experience. As AI is building its capabilities, he has the experience to say, you know what, this doesn't sound right. Or you know what, yeah, this sounds right. I'm going to use this recommendation. What about the new recent graduate who is now using AI for clinical decision support? He or she does not have that decades of experience. So that means that medical education has to be wholesale reformed to prepare young, inexperienced physicians to deal with AI as we move forward. I really hope people smarter than I are figuring out medical education, because I certainly don't want a generation of dumb doctors treating me in the future. What about you?